there because of people getting a positive test at home. And we have 327 people in hospital, 14 are in ICU, and 3 people are ventilated. And the Chief Health Officer will give us more information about that in a moment. 36,492 tests were done in 24 hours, and our vaccine coverage is 90.93% at least one dose, and 87.26% people are fully vaccinated. And in good news across the state, 624,328 people have had their booster. Can I please say to people that now is the time to book in and get your booster shot? And of course, next week we begin our vaccinations for our young people. Of course, there is a lot of concern out there amongst parents about their children and return to school. Can I assure people that the Queensland Government is working actively on a plan? I've got a meeting with the Education Minister shortly after this meeting. I've been speaking with her regularly this week. National Cabinet is working on a framework. We're doing modelling in relation to the peak of this Omicron wave. And let me assure parents that we will not be sending primary school students back during the first week of school if we are heading towards a peak. So we are looking at a 1 to 2 week delay in relation to the return to school. We will give you more concrete decisions on this over the coming days. But I just want to assure parents that that is definitely not on the agenda to send primary school children unvaccinated to school if we are in the peak of this wave. This is a common sense measure, and like I said, that modelling is happening, and I'll update people about that. Now, a couple of things. First of all, can I strongly recommend work from home where you can? This has already been sent out to our public servants. Our frontline workers are out there working around the clock. But can I stress to employers, if you do not need people working in the city at the moment, please work from home. This will help slow down this wave, but I don't think this message has been getting out very clearly to employees. A lot of people at the moment are still on their summer break. Please go and enjoy your summer break, but do that responsibly, remembering we are in a pandemic. Now, what I don't want to see is people not wearing these masks. It is really important. If you are going to a cafe or a restaurant, you are wearing these going in, and it is very important that staff are wearing these as well. Just because you're on holidays doesn't mean you are not part of a pandemic. So please make sure that if you are sick, get tested and stay at home. It is really important, if you have any symptoms, please stay at home. Do not go to the workplace or to a party and infect other people. Okay, wear a mask and wear it properly. And we've said this before and we'll say it again, avoid large indoor crowds, especially if you are vulnerable. So my message, once again, to our elderly population is please restrict your movements until you've had your booster shot. So please stay at home where you can. We are going to reactivate the Care Army as well to help look after our most vulnerable. But everybody needs to make sure that they are watching very closely their movements. And if we do this, we are not going to stop this wave. This wave is going to happen, but we will make sure that we are keeping as many people safe as possible. And as we know, that in many young people and in most people, this is a very mild condition, but we do know that some people can get very sick. If you are unvaccinated, please go and get vaccinated. I've been looking at our map of where people are vaccinated. Can I do a big shout out to Mackay? 95%. If you remember, Mackay region was one of our lowest regional centres when we first started the campaign to get people vaccinated. I really want to do a shout out to Mackay, 95%. Cairns as well, 92.9. Most Wide Bay, 94.1. Around Brisbane in the southeast, Nearly every region is over 90% except for the Gold Coast. Now, we are seeing case numbers on the Gold Coast. If you are unvaccinated, please go and get vaccinated. If you have not had your second dose, make sure you get your second dose. And if you're due your booster, make sure you get your booster. Can I also make some comments about the rapid antigen tests? As I said, we have been procuring extra rats for people. So there have been 221,000 rapid antigen tests have been deployed to testing clinics. 150,000 were distributed yesterday alone. And we've also been able to source an extra 60,000 to be distributed into the regions over the next few days. And we expect supplies of 1.3 million by this time next week. I've also had reports that they are back on the shelves in some supermarkets. I know they are going very quickly. If I can please urge people to please take one box for your family and please use that if you have symptoms, because they are in short supply at the moment. But this is not just a national issue, it's an international issue in terms of the supply of these rapid antigen tests. Finally, in relation to freight entry requirements, following that National Cabinet decision, we've removed the requirement for freight workers and truck drivers to provide a negative PCR test to enter the state. This will keep our freight going. We are also having further meetings to look at essential workers in terms of keeping our food and freight supplies operating in this state. And I think people can realise this is a very difficult time for Queensland at the moment, probably the likes that we haven't seen before. We have pressures that will grow on our hospitals. Thankfully, we do not see a lot of people in ICU at present, but I have health workers staff working around the clock. I have them working in our hospitals, doing our vaccinations, our boosters, also doing our shots for our children starting next week. Don't forget the GPs are also mobilised to do the vaccination as well. I have frontline workers that are out and about, and of course, if they test positive, they're out of action for 7 days. And of course, we have, which I think is nationwide, issues with supply. But at the moment, we are monitoring all of this very carefully to keep the supply and the stocks on our shelves. This is going to be a short, sharp wave, but it is going to really test the resilience of this state. And I just want to assure the public that we are working on this every single day and looking at the requirements that are needed. The Health Minister will talk tomorrow about elective surgery in our public hospitals. Already some of our health and hospital services are making some reductions there. As you can appreciate, health staff are getting sick. And when health staff are sick, they are having to take time off to recover and get better. This is happening during the Christmas New Year period when some people are away as well. And schools are not operating at the moment, which is also comforting as well. So just want to assure Queenslanders that we are working on this every single day, going through all of these issues and also working with National Cabinet as well. So I'll hand over to the Chief Health Officer.